Hi, I'm Dr. Sheila Reyes from the Philippines, reporting virtually for Room Now at the ACR 2023. Joining me today is a colleague of mine and also a very dear friend, also from the Philippines, Dr. Lisa Traboco, where she will talk about our poster abstract number 2078 on the interim evaluation of a 6-year remote online adaptive learning platform module for rheumatology fellows, or what is known as Applied Rheumatology on the Go, or ARGO for short. As a quick disclosure, I'm also part of the paper, but it's Dr. Traboco as the main author. So, Lisa, let's get the ball rolling. Could you give us a brief background of the study and what motivated you to pursue this project?
Okay, so this actually started out as an accident. So there was no intention to create this for medical education. I started this as a way for me and us, our co-fellows, to study for the boards. So as I discovered creating the modules using the platform called Serego, and I was able to share it with our co-fellows and our co-batchmates from UST. We saw the benefit of continuing the project as a means of self-study. So towards the succeeding years, I still didn't really have a clear research agenda for it. I just continued it to share it with junior fellows. But after some years and further experience as a clinical rheumatologist, finally it had some direction. Thankfully, I kept some of the information as to how many fellows have been joining since it was started, and that's what we put in the poster for today tomorrow.
Okay. So with this app, how is it different from other apps, or are there special features that make it different and a good because it's in the title, an adaptive learning platform. So how does that go about? I mean, what happens when a rheumatology fellow access the app?
Okay, so it uses the platform called Serego, wherein if you have an item that a student will answer, it uses the concept of spaced repetition. So if the student answers the item or topic correctly, the program will move that item to be answered again at a later date. If the student answers the item wrong, the program will keep on nagging the student until the student will be able to answer it correctly. Now, some differences versus a usual quiz bank, no. It's the choices are randomized, so the student cannot remember, oh, it's letter A, letter B, or letter C. And then you can also tweak. For example, I've put some cases there, case-based scenarios, and then I would tweak some of the instances, and then the answers is going to be different. So those are just some ways to keep the learning different, keep it exciting. There's also some flashcards where there's lots of visual aids, and some of the items there are you have to click on the correct anatomy, or you have to click on the correct instead of text-based choices, you have to click on the correct photo. So it's a labor of the years of learning. Sometimes I would put some of the new items that I learned in terms of photo, and then put it there for teaching.
Okay. The app really sounds great. And for those watching, just to give a more in-depth understanding, is that this app was used by the rheumatology fellows as a reviewer, or yeah, let's just use the term reviewer in
Reviewer.
preparation, yeah, in preparation for their rheumatology board exams. That's right.
Yes, it's for the rheumatology board exams. Usually I enroll them a few months before the exam, because I didn't want it to feel like a sample exam wherein they would just run through the items. So in addition, I do have a little notes there, that for example, why is this answer wrong, why is this answer correct, so that it will help, and references, extra references, so that it helps with the studying. So a lot of the past enrollees have said that they use it like they would read the book, the textbook, and they would either use it as a pre-test or post-test in order to gauge their weak subjects. So I like it in a sense that it's different per student. So what student A would take as the module will be different, and the scores will be different. So it's really individualized, and the students seem to like that. It's really directed to their needs.
Okay, so now that you've mentioned some of the students' feedback, I'll jump off from that. How is the evaluation? I mean, the interim. I guess
Ah,
the
yeah.
your app is. I mean, the app is still continuous, and so this is just an interim evaluation of the platform. So, could you run us through the results of your evaluation, and probably what future directions you would plan to have for this app?
Yeah. So we asked some of the present enrollees on what they felt was the usability of the app. So there was some great feedback regarding the style, the layout, the ease of use of the app. So it's very intuitive. You just got to click, 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 and the like. There was some comments on the content, and the request to have more visual aids, uh content wise, since this has been going on for almost 6 years. So a couple of versions of the textbooks have passed by since then. So I really need to update many of the items. Although what we do is, when a student finds something that they feel is no longer updated, they can inform me and I can update it accordingly. But of course, it's a challenge because they cannot finish all present 2,450 items. So it's a
It's a
process.
lot.
It yeah, it's a process for them to actually check it along with me. And um future wise, I mentioned the images. So rheumatology is not just going to be text based in the future in terms of tests, and we do a lot of uh we see things, a lot of physical findings. So I plan to add a couple of more x-rays, MRIs maybe, and of course, although it wasn't used much during our time as fellows, the ultrasound, definitely something that I myself need to learn again, but it's going to be part and parcel of current and future fellows.
Okay, so it's nice to know that the app has different types of exams, right? It's not just your MCQs, but there are images, essays probably. Okay.
There's fill in the blanks. Fill in the
Oh,
blanks.
all right.
Not
Yeah,
essay.
fill in the blanks. Oh, yeah.
Mhm.
Hopefully essays as well. Right. Okay, so that's good because there's a variety of the test questions. So really want to ask this question before we end. And knowing that you are, especially because you're an informatic grad student, apart from being a rheumatologist and a researcher, AI is really a hot topic right now. What do you think are the challenges in asking people to use technology like Sergo?
Yeah. Cerigo is actually incorporating AI into their app right now. So one of the things that they plan to do is, for example, you can upload the paper and then you ask the AI to develop questions from that paper. And so it kind of lessens the work that you have to do as a doctor, and just focus on editing the questions, making sure that it fits the goals for your students. Uh, there has been some pushback on using AI because of the fears of many educators that it's going to make students lazy and the like. But in reality, the machines are not gonna make the decisions. It's still gonna be us to double check. It's still going to be the human part of the human doctors who will be confirming and doing the quality evaluations of the things that AI is going to produce. It's just going to make your life easier by, lessening the effort on creating all those processes that have doubled for us doctors.
Great. That was very well said. Again, congratulations on the paper. And this paper will be shown, will be available in the poster hall tomorrow, right? That's
Yeah,
November.
tomorrow.
Yeah, that's November 14. Okay, so thank you very much again, Lisa, for joining us and sharing your time. Um, Enjoy the rest of San Diego and ACR 2023.
Too
Um,
soon.
yeah. So guys, follow me on X at Rumarampa and tune in to Room Now for more reports and videos of the ACR Convergence 2023. Bye.